Hi everyone, and welcome to TS Fibro. Today I'm going to talk about fibromyalgia and having trouble swallowing. I have this trouble. It's not all the time, but it feels like when I'm eating, it's like I can't get it all the way down and it hurts bad. And I was just wondering if anyone else had it. It's called dysphagia. And dysphagia and fibromyalgia, difficulty swallowing. Dysphagia and fibromyalgia. Dysphagia is a medical term that means that a patient has difficulty swallowing. There are numbers of different conditions that can cause dysphagia, and someone who suffers from dysphagia often finds that it makes life very difficult. Depending on their condition, swallowing can be very painful, which makes eating and getting enough nutrition a challenge. Mine can happen even if I'm drinking something. It usually happens when I'm eating, but sometimes it does when I'm drinking something. And what's even more alarming is that many people with fibromyalgia report having problems with dysphagia. So what are some of the things that cause dysphagia? Is there a link between the condition and fibromyalgia, and what can you do to treat it? What causes dysphagia? There are a number of different things that cause dysphagia. Anything that interferes with the complex system of the nerves and muscles that control the esophagus can make swallowing difficult. But some of the most causes are achalasia, a condition that causes the muscles in the esophagus to constrict; diffuse spasm, a condition where the muscles spasm uncontrollably, usually after swallowing; esophageal stricture, a narrowing of the opening of the esophagus caused by scar tissue or tumors; gastrointestinal reflux disease, or GERD, the gradual destruction of the tissue in the esophagus caused by acid from the stomach washing up into the esophagus. Dysphagia can also occur without any obvious source, but whatever the cause, the symptoms are often similar. The most common symptoms are difficulty swallowing, pain in the throat, frequent heartburn, a hoarse voice, and regurgitating food you've already eaten. In most cases, dysphagia isn't dangerous, but it can lead to dramatic weight loss and can be life-threatening if it causes you to regurgitate your food into your lungs. And while we don't always know what causes the condition, we do know that it is abnormally common in people with fibromyalgia. A study by the National Institute of Health in the United States determined that a significant number of patients with fibromyalgia reported problems with swallowing. Patients in the study reported suffering from dysphagia at a rate of 40% higher than people without fibromyalgia. Unfortunately, the reason this sort of symptom is common in people with fibromyalgia remains a mystery. There's so much that we don't know about how fibromyalgia works, including why it would cause dysphagia, but we can speculate on a number of possibilities. People with fibromyalgia often experience muscle weakness. This weakness could explain why they suffer from dysphagia. The muscles that control the process of swallowing may be affected by the general weakness caused by fibromyalgia. In addition, we know that people with fibromyalgia have problems with their nervous system. An NIH study found that patients with fibro had significantly more neurological abnormalities than a controlled group. If fibromyalgia is a condition that affects the nervous system, as many doctors suggest it is, then it could be causing a breakdown between the nerves that control the esophagus and the brain. This would explain why people with fibromyalgia have a hard time swallowing. Their brain can't control the muscles in the esophagus as it normally would. But until we know more about the condition, we can't say for sure what the link is. Luckily, there are some things you can do to treat this condition. Treatment options. The first step in treatment is a diagnosis. The most common way to diagnose the condition is with an imaging test like a barium X-ray. Essentially, the patient drinks a contrast material, barium, which coats the esophagus and makes it easier to see on the X-ray. The doctor can then examine the image to see if your esophagus is expanding correctly. And this examination can also be done with an endoscopic camera. Your treatment will depend on what's causing the condition. If the condition is caused by weakened muscles, there are a number of exercises you can do to strengthen the muscles, and you can learn different swallowing techniques to compensate for the weakened muscles. Your doctor will be able to advise you on what to do. If the treatment is caused by muscle constriction in the esophagus, there are a number of medications that can help relax the muscles. In addition, a surgeon can perform a procedure to dilate the muscles and force them to relax. Finally, a surgeon can remove portions of the esophagus to widen the space for food to pass through. When I started having the problem swallowing and it hurting, it feels like it gets stuck in your throat, and it's just like it feels like a baseball trying to go down your throat, and it really hurts bad. I went to the doctor and was telling him, and he didn't really even examine me. He just told me, oh, it's acid reflux, and gave me a prescription, which didn't help. So I suggest that anybody that has trouble swallowing, if you haven't already been to the doctor, go to your doctor and ask him to look at it. So, maybe even do tests so you can figure out maybe which one it is and what medication or what you can do to help it out. I'm going to have to go back in and tell him that didn't work and we need to do something else. But anyway, thank you all for listening to the video. I hope everybody has the best day they can. And please don't forget to hit that subscribe button and the notification bell so you'll be notified when I put up a new video. And hit that like button if you like it, and dislike if you don't. And if you don't mind, just tell me why you don't like it or tell me why you do like it. And this is something that I didn't think anybody else had till I started researching it, and I found some articles on it. Anyway, everyone have a good day. I pray for a cure, and I pray you have a pain-free day. God bless everyone.